Governor Walker announced his decision today regarding the future of Wisconsin's healthcare exchange. The federal government will be setting it up and not the state. Good evening, everyone. Thanks for joining us tonight. Now, to some, Governor Walker's decision was not a surprise, given his and the GOP's long opposition to the federal healthcare law.
But not everyone is on board with the governor's announcement today. The exchange offers a number of insurance options for individuals and small businesses to buy. Today, Governor Walker explained his decision in a conference call. Tonight, we have balanced coverage. Governor Scott Walker has chosen the path for the future of healthcare in Wisconsin. He says no matter which option was chosen, taxpayers would not have meaningful control over policies and services in the state.
In the end, decisions regarding eligibility, minimum standard of coverage, and all other important details are ultimately determined by the federal government.
The governor adds if he had decided on the state option, Wisconsinites would face the risk of a federal mandate lacking long-term guaranteed funding.
A state-run exchange might expose the taxpayers of Wisconsin, not just as federal taxpayers, but as individual state taxpayers, to greater liability, to greater cost in the future. And so that's ultimately what made our decision.
Dr. Ashok Rai, who represents one of the largest multi-specialty medical groups in Wisconsin, says as a healthcare provider and one that's in the insurance business, his goal is to work with the federal government in setting up a state-run exchange.
Not a state-paid-for exchange. We want a state-run exchange. We know what we're doing. And we want Wisconsin residents to get insurance from Wisconsin-based companies or other companies, but have it regulated by the state of Wisconsin, not the federal government.
State Republicans say the governor made a responsible decision by not picking up the tab, especially given the fact full details of the Affordable Care Act haven't been released.
The governor really wasn't given a whole lot of information to make his decision on in terms of what flexibility the states were going to be given. But unfortunately, what we found with Medicaid and with other programs is, we really are going to be picking up a large share of the cost if we go with a state-run program.
The governor did not have a figure on those costs, but the State Department of Health Services estimates the cost for the state to run the exchange could be as much as $60 million a year. State Democrats say the governor made the wrong decision, accusing him of choosing his party over the interests of Wisconsin healthcare consumers.
We should have created the exchange here in Wisconsin through a transparent, bipartisan, and accountable process using all the federal money that was available. Instead, Governor Walker turned back almost $40 million in federal money that we could have used to create that.
Now, the law is expected to provide coverage to more than 30 million people nationwide through the exchanges and expanded Medicaid programs. The Medicaid expansion is voluntary, and here in Wisconsin, Governor Walker said today no decision has been made on whether our state will do it.
So that's what Wisconsin is doing. What about other states in the nation? 14, including ours, have said they're going to defer to the federal government. 22 states and the District of Columbia have decided to run their own exchanges or partner with the feds. Today was the original deadline for leaders to decide, but late last night, the Obama administration announced a one-month extension. It gives governors more time to make up their mind.